Ladies, let me ask you something raw and real. Have you ever felt that spark, that fire inside you, start to flicker? Maybe you're lying in bed at night, wondering why you don't feel like you anymore. The passion, the desire, the connection with your partner, gone. And deep down, you're terrified it's not just age. You're scared it's something you're taking every single day. Your medications. What if the pills meant to save your life are silently killing your desire? I'm Dr. Helena, a women's health specialist who spent 20 years helping women like you reclaim their vitality. Today, I'm pulling back the curtain on a truth the medical world rarely talks about. If you're a woman over 45, this could be the most important 15 minutes of your life. Stay with me, because if you don't hear this now, you might regret it later, when the spark is harder to reignite. Oh, and drop a comment below. Tell me where you're watching from. Are you in New York, California, or maybe a small town in Texas? I want to know who's with me on this journey. Chapter 1. The Silent Thief in Your Medicine Cabinet. Let's talk about the elephant in the room, your medications. You take them to lower your blood pressure, ease your anxiety, or manage your pain. You trust them because you trust your doctor. But here's the gut punch. Some of these pills could be stealing your libido, your intimacy, your you. And no one warned you. Here's what I see in my practice every day. Women like Susan, 52, who told me, "Dr. Helena, I feel like I'm betraying my husband. I love him, but I just don't want him anymore." Or Linda, 60, who said, "I miss feeling alive. I miss feeling desired." These women aren't alone, and neither are you. Medications like antidepressants, SSRIs like Prozac or Zoloft, blood pressure meds, beta blockers, and even birth control pills can mess with your hormones, your brain chemistry, and your sex drive. SSRIs, for example, can lower dopamine, the feel-good chemical that fuels desire. Beta blockers can reduce blood flow, making arousal harder. And nobody's talking about it because, frankly, it's awkward. But I'm not here to sugarcoat. I'm here to give you the truth. If this is hitting home, hit that like button to spread the word. Don't let other women suffer in silence. Chapter 2. Why you feel betrayed by your body. Let's get real about why this hurts so much. You're not just losing desire, you're losing a piece of who you are. You're scared your partner will stop seeing you as vibrant, sexy, alive. You regret the years you didn't know this was happening. And worst of all, you feel betrayed by your own body. Here's the science, but I'll keep it simple. Your libido isn't just about feeling sexy. It's about your brain, your hormones, and your nervous system working together. Medications can disrupt this delicate dance. For example, antidepressants can blunt your brain's reward system, making intimacy feel like a chore. Blood pressure meds can lower testosterone, which, yes, women need for desire too. Hormonal treatments, like certain menopause therapies, can throw your estrogen and progesterone out of whack. But here's the kicker. You don't have to accept this as just aging. You deserve to feel alive, desired, and seen. And the first step is knowing what's working against you. Imagine looking in the mirror and not recognizing the woman staring back. That's what happens when you let this go unchecked. Don't wait until the regret piles up. You're watching this now for a reason. Don't miss this chance to take control. Chapter 3. What you can do about it. Now, here's the part where you take the reins. I'm not saying you should toss your meds out the window. Never stop a prescription without talking to your doctor. But you can fight back to reclaim your spark. Here's how. 1. Talk to your doctor, and don't be shy. Tell them about your libido concerns. Most doctors don't bring it up because they're focused on your big health issues. But your desire matters. Ask if there's a lower dose option or a different medication with fewer side effects. For example, some SSRIs like Wellbutrin are less likely to dampen libido. 2. Boost your body naturally. Exercise like brisk walking or yoga ramps up blood flow and endorphins, which can reignite desire. Eat foods rich in zinc and healthy fats. Think avocados, nuts, salmon to support hormone health. 3. Talk to your partner. This one's tough but vital. Share what you're going through. Intimacy isn't just physical, it's emotional. When you open up, you rebuild trust and connection. 4. Consider therapy or counseling. A sex therapist or counselor can help you navigate these changes, especially if medications have shaken your confidence. Here's the truth. You're not broken. You're not too old. You're a woman with fire still inside you, and I'm here to help you fan those flames. If you're ready to take action, subscribe and turn on notifications. I'm dropping more tips like this every week, and you don't want to miss them. Chapter 4. The Hidden Cost of Doing Nothing. Let me paint a picture of what happens if you ignore this. The distance between you and your partner grows. The regret festers. Why didn't I do something sooner? You start to believe this is just how it is at your age. But it's not. Every day you wait is a day you're not living fully. You're not just losing desire. You're losing moments of connection, joy, and intimacy that you deserve. Don't let fear or shame stop you. You're watching this video because something inside you is screaming for change. Listen to it. Thousands of women are waking up to this truth right now. Don't be the one left behind, wondering what could have been. Act today. Your future self will thank you. Closing scene. Ladies, I've been where you are. I've sat with patients who felt like their best years were behind them. But I've also seen them light up again, laughing, loving, living. You are not defined by a pill bottle or a number on your birth certificate. You are a woman with dreams, desires, and a fire that's still burning. Take one step today. Call your doctor. Have that hard conversation with your partner. Or just look in the mirror and say, I'm worth it. Because you are. If this video spoke to you, share it with a friend who needs to hear it. And comment below, where are you watching from and what's one thing you're going to do to reclaim your spark? I'm Dr. Helena and I'm rooting for you. Let's keep this fire alive.